Today we're talking about the skeletal system, so I encourage you to stop and replay parts of this as you need to. First of all, try to think of the 5 functions that we've talked about in terms of bones. So please pause this presentation and record those. Now that you're back, hopefully you came up with these 5. One more review question. See if you can recall the 4 shapes of bones and describe each. Please stop the presentation. Hopefully you came up with these answers: long bones, short bones, flat bones, irregular bones. These are the things that you should know from today's lecture. So you can either stop and record these questions and write their answers, or simply check your notes at the end to make sure that you found all of these things. To begin with, the skeletal system is obviously more than bones. Bones by themselves really wouldn't be of much value. It's the joints, the cartilage, the ligaments, and the tendons that work together with the muscles to make your skeletal system effective. Your skeletal system is divided into 2 different divisions: the axial division and the appendicular division. And we'll look at those 2 on the next slide. So the axial refers to the long axis, basically your spine, your brain, or your skull, I guess, and the ribs. And the appendicular section is all the arms and legs, the limbs and girdles that are attached. This picture will make this a little more obvious. What you see in the green is the axial system, and whatever the rest of them are, they are all part of the appendicular. As we look closely at each section, obviously the axial system will be your cranium and face, your thorax, which include your sternum and your ribs. These are the auditory ossicles, which is a fancy word for the ear bones that transmit the sound wave from your eardrum to your inner ear. And then next we have the vertebral column, and I want to give you a way to remember how many of each of these type of vertebrae they are. Cervical, think of the 3 times that you eat meals. Breakfast at 7, the top, the neck vertebrae. You eat lunch at noon, that's the thoracic, and then the lumbar ones, you eat dinner at 5. Breakfast at 7, lunch at noon, dinner at 5 will help you keep track of how many of each of these there are. Continuing then with the hyoid bone, and that has a unique feature that none of the other bones have. It's the only bone not to be attached to another bone. So you can see its location here in the throat. Continuing, looking at the vertebrae again, cervical means neck, so these are the neck vertebrae. Thoracic obviously means chest, so these make up your chest cavity. And then lumbar is towards the bottom of your back. Looking now specifically at the parts of the appendicular skeleton, in the shoulder girdle or the pectoral girdle, to refer to the muscle that covers this, we have the clavicle, and then we have the scapula. You may remember from chapter 1 we learned where the acromial area was. Well, the acromion then is just this little extension off of the scapula. The upper limb then contains the humerus, the radius, and the ulna. We see how as you turn your wrist over, those bones go from parallel to being crossed. The carpals would be the bones of the wrist. The metacarpals and the phalanges then would make up the hand. If you think about, to remember where the carpals and metacarpals are, think about carpal tunnel disorder. Carpal tunnel happens in the wrist when there's some irritation and swelling that then causes stress or presses on the nerve. So that happens in the wrist. As we move to the lower half of the body, we have the 2 hip bones, or the coxal bones. Each coxal bone is made up of 3 different areas: the ilium on the top, the ischium, which is kind of in purple here, which makes up the outside and bottom. That's where you sit, and you're the part that of the hips that actually touches the chair. And then the pubis here in the middle. And then in the middle is the pubic symphysis, which is cartilage that's going to hold those two bones together. This is just a different picture to kind of show you the same things. So you can see the ilium on the top, the ischium coming down here, the pubic part of the bone over here, and then the symphysis again in the middle. An x-ray version, you can see some of the additional parts of the femur in here, the head of the femur, the neck, the greater trochanter, and the lesser trochanter. And you'll know those things by the end of next week. The labrum then is a piece of cartilage that separates the femur from the hip bone. And it works kind of like the meniscus does in the knee. You also have a labrum in your shoulder, and in both areas that's prone to injury. In the hip particularly, hockey goalies who kind of go from standing up to dropping to their knees frequently would have a greater chance, I guess, of tearing their labrum. These are the bones of the lower leg, nothing too fancy here. The femur, the patella, the tibia, the fibula, and then the tarsals make up the ankle bone, the metatarsals, the foot bone, and the phalanges are the toes. We want to know a couple things about describing the metatarsals and the phalanges. First of all, we would refer to the three bones of the toes or the finger by words we used in chapter 1. The farthest phalange away would be the distal one. These would be the middle ones then, and the ones closest to the metatarsals would be the proximal phalange. So again, proximal, middle, distal. And then as we number them from this side over to the lateral side. So 1, 2, 3, 4, and 5. Here you're looking at the ankle joint, and what we want to know about this is that it's actually two joints. So the first joint up here between the tibia and the talus, and a second joint between the talus and the calcaneus. And we'll talk next week about which joint movements each of those two spots allows to occur. So again, an x-ray in your foot from the lateral side, you can see the tibia on the top, and then the talus over here, the calcaneus back here. These would then be the metatarsals, and again, those can be broken just as easily as some of the other foot bones. To make this a little easier as you're learning this, these are the pronunciations for some of the markings that we're going to talk about. So these are all projections or lumps or like growths, if you will, on a bone that have a special name. And these are important because this is where a lot of the muscles attach. So we have tuberosity, tubercle, crest, trochanter, epicondyle, spine, process, and malleolus. And the malleolus are on the ankles, so you have one on the inside, the medial side, and one on the lateral side. Projections that help form joints, some pieces are like the head of a particular bone, or again the word condyle, pronounced kind of like Lyle. And then meatus is kind of an opening through a bone, fossa, like moss, and then foramen. We talked about the foramen in the skull before. That's again basically a big hole for something to go through. If you've wondered where the 206 total comes from the body, you can flick through these slides and figure it out. This is the bone count from the axial skeleton. As we look at the appendicular, here's the upper count. We have to multiply by 2 because we have a right and a left arm. And then again multiplying 2 for the left leg and the right leg. And if you add all those numbers up, you get the magic total of 206. And then lastly, these are the lesson objectives again, so you want to make sure that you have all these things in your notes. And if not, either look in your book to find them or look back to those particular parts of our presentation. So, that is it for the skeletal system.